Hello, welcome back to News World here on Newsroom Africa, Channel 405. Thank you for joining us. My name is Vic Naidoo. Earlier, my colleague Matsepela Molloy chatting to the Methodist Church of Southern Africa, now appointing one of the first female bishops. Wonderful times. And if you want to catch up on the interview, remember you can subscribe to our YouTube channel at Newsroom Africa. Now, there is a South African myth that it's better to get circumcised in winter with holidays around the corner. Deputy Chief of Party at Right to Care, Sizwe Hlongwane, is encouraging men to be circumcised this summer to remain healthy and help the fight against HIV and AIDS. Sizwe joins us in studio to have this discussion with us. Sizwe, welcome to News World.
Greetings and greetings to your viewers.
Thank you. So, I mean, we're about to talk about circumcision. It is a contentious debate. I mean, you have the two sides to every story. You know, the people who are against circumcision and people who are for circumcision. And before we get into Right to Care's campaign urging people to have circumcisions during summer and trying to debunk this myth of circumcisions during winter, there is a statement, there has been research made into this that says that getting circumcised reduces the risk of transmitting HIV and AIDS. Maybe take us to the biology of how circumcision reduces HIV susceptibility.
Okay, thank you very much for the question. Probably the biology and the studies that have been conducted around the topic indicate very critical things. So we have actually seen that amongst men that are having sex with females, for example, the chances of getting HIV are actually quite increased if you're not circumcised. And the reasons for that is that if you look at the male organ and the biology of it is that the covering, which is called the pubis, it actually covers the area, and the area that is covered, which is the head of the penis, it renders it very soft and supple. So during the process of sex or coitus, these areas it then becomes very susceptible for laceration, which then becomes an entry point for HIV.
Okay.
Another issue that we also looking at is that if you have this foreskin, it actually increases your chances of having STI, and lacerated STIs then actually creates an entry point also for HIV. So basically we are saying that if that area is covered, the chances of HIV are quite high.
I mean, you make a valid argument, but then what would you say to those people, those men who decries the practice, saying that maybe it's unnatural, it's unnecessary, you know, all mammals have foreskin?
Yes. Well, I think the era that we're in now, with the advance of HIV, we are actually knowing that we really need to do everything that we can to prevent HIV.
All right.
So basically, to a parent that is actually still in doubt about doing this practice, we would actually encourage them, because the data actually tells us that for every circumcision done, there's about 5 to 15 new infections that are averted. So the data is out there, and we are encouraging people to really try this method of prevention.
Would you can continue?
So obviously it's not an only method of HIV prevention. There are other methods. And
we also, just to clarify to our viewers as well, we're not saying that circumcision is a prevention method. It reduces the susceptibility to contracting the virus.
Absolutely. So the broader definition of this is that it actually reduces the chances of HIV by 60%, which means that it's not 100% a preventive method. There are other methods that are still out there that we're also very familiar with, which is ABC. And we are saying that HIV by far is one of the cost-effective methods of HIV prevention. Because if you
circumcision.
Yeah, circumcision is actually by far the most cost-effective method of HIV prevention, because if you look at what we are trying to drive at is to actually prevent people from getting HIV, so that the cost of managing HIV can be decreased. We know that our country when you put it in context, we cannot afford to actually continuously invest a lot of money in HIV management programs.
Sizwe, you're talking cost, and you're saying, okay, HIV, one of the ways to reduce the transmission of HIV and also cost factor is get a circumcision. And Right to Care campaign, it offers a variety of sexual health services from HIV and AIDS, STIs, TB, and you're also offering circumcision services. Let's talk cost factor here. How much does it cost to have a circumcision? Because, if you're a grown man, if you haven't had this done when you were an infant, we should also have that debate. How much does a circumcision now cost?
So HIV is actually having a strategic partners that we are working with. We are NGO. So we actually get our funding from PEFA under 2 grants, which is USAID and as well as CDC. So the services that we are offering are at 0 cost to the patient, and we are also utilizing the NDOH facilities to offer these services. So we are saying to the community, if you go to any government institution, you can actually access the service free of charge. Free of charge.
Yeah. All right. That's not the only way that people can access male circumcision. We are obviously aware of traditional initiations. And let's maybe talk about that, because we've also heard many stories about how traditional initiations can go wrong. How is Right to Care campaign working with working with traditional initiations and those groups?
Yeah, it is actually important to note that for every success of any program, it needs to be taken in the social context. WHO in 2007 actually did a lot of analysis, and upon those analyses, they actually found out something very interesting. One of the factors that they actually found was that in areas where circumcision, traditional circumcision, or any circumcision for that matter, was not prevalent, there were actually a very high prevalence of HIV.
Okay.
So which now tells us that when we are implementing HIV in the South African context, we cannot actually close out the traditional male initiation sector. So Right to Care has taken an initiative of working with traditional leaders that are involved in the sector to ensure that the circumcision that is produced or that is actually coming out of the traditional male initiation sector is actually compliant with WHO standards.
Right.
So by compliance, we are saying that when you want to have a proper circumcision, there should be a complete removal of the foreskin so that you can get the benefits, full benefits of circumcision.
And with traditional initiation, is it not removing the full foreskin?
It is removing the full foreskin, and that's why our partnership is so important, because it's not just only on the circumcision. We are also looking at a broader program, because we have seen that probably most of the deaths that are happening in the traditional space, they actually happen as a result of conditions that could be prevented if a person were actually exposed to pre-screening before they go into the initiation space. So Right to Care is actually partnering with them, together with the Department of Health, to offer those services so that all these pre-existing conditions can be identified and treated before they go into the initiation space.
We're joined in studio by Sizwe Hlongwane from Right to Care, and we're chatting circumcision and how circumcision can be used as a measure to reduce the susceptibility of HIV and AIDS transmission. And the Right to Care campaign is currently trying to promote circumcisions during summer. We know we're heading into the summer months now. There seems to be this myth, it's new to me, a myth that one should only get circumcised during winter months. Maybe take us through this myth and how Right to Care campaign is trying to change people's perceptions of circumcision and when you should be circumcised and when you can be circumcised.
Yeah, so in the South African context, for example, you are seeing that a lot of people have been believing that circumcision can only be done in winter. This is actually largely related to the traditional perceptions, because most of the traditional male initiation actually happens in winter. But we are saying to the general public that the wound healing process is actually the same in winter as well as in summer. It's actually much more convenient to go to the clinic now because there's not many queues that you would actually be frustrated with when you go to the clinic around the summer because people are actually on holiday mode.
Well, Sizwe, while you're talking about the healing time, let's talk about the procedure. I mean, we won't get into the graphic details of it, but how long do you take to heal? I mean, is it a one-day procedure? Do you have to stay in the hospital taking care of the wound?
So the procedure it's actually classified as a very small. It's a small circumcision procedure. It actually takes about 30 minutes to complete, and the healing process is for the first, like after the procedure, you need to come back for the follow-up at 24 hours, and then you need to come and see us after 7 days. But within the first 5 days, the wound is already starting to heal, and obviously you can actually see that the person or the person that has undergone the circumcision can also go back to normalcy and full work function as they used to before the circumcision procedure itself. So what we're saying is that it doesn't necessarily disrupt your normal working, if you're a male that is actually working.
You could go to work the next day?
Yes, you can obviously go back to the next day, and
you just have a little bit of discomfort.
It's a little bit of discomfort that is managed through just a small analgesia and the like. But this program, we've actually advanced it to actually even reach the workplace, where we are saying to men that if you can come to us during lunch hour, we can give you the circumcision within 30 minutes, and after that you can go back and do your duties.
Sizwe, I'm also interested to know that, I mean, there's also this debate when we say why circumcision is contentious, because and you have some countries around the world that have actually banned it until a person turns 18 years old because it's their freedom over their own body. What about parents who have young children or boys? Does Right to Care campaign get involved in that aspect as well, where you encourage young boys and babies perhaps to be circumcised, or is this just a campaign focused on adult men?
So there are different campaigns actually are driven by country policy. Well, if you go to Swaziland, for example, they are actually advocating for neonatal circumcision. In South Africa, we are focusing on a pivot age, which is 15 to 49, and that is actually largely affected by our data. We are seeing a lot of new infection around that age group. So definitely what we are saying is that parents, they can actually take their children at any given age to the hospital, but as far as the upscaling of VMMC in South Africa, the pivot age is affected by the new infection rates that we are seeing around the age of 15 to 49.
And what about when we look at HIV infection rates, when we look at it around the world, and men around the world who are circumcised or choose not to be circumcised? What are their HIV rates?
Probably it would need us to take just a little bit of a step back and see what actually brought us to the process or the program of upscaling VMMC.
Yes.
So there were random, when we saw the development of the virus to epidemiological levels around late 90s to early 2000s, there were studies that were done in Uganda, in Kenya, as well as in South Africa. Those studies actually indicated very clearly that if you are circumcised and you are engaged in heterosexual sex, your chances are reduced by 60%. And then there's something that also happened in 2007. So when you did a broader analysis of where the pockets of HIV were identified, and it was actually seen that in Africa, for example, Africa was actually leading the whole world in terms of new infection, as well as the high prevalence of HIV.
Right.
And then when you take into context now the African countries, and you starting to really look at in isolation the countries, we saw that in the eastern part of Africa, as well as the southern part of Africa, that's where the high burden was actually found. And then the decision was taken that all those countries in the eastern and the southern part of Africa, the program then developed to the level that is in now.
All right, Sizwe, in closing, before we let you leave, do you find men are hesitant for circumcision to come forward and have a circumcision? I mean, it is a scarier thought. You know?
Yes.
I mean, if you think about the process of it, it is scary. Are men hesitant?
Yes, we find that with education, men are actually willing to come through to the circumcision. But we want to tell them that probably one of the barriers for most men is pain.
Yes.
We are saying that the pain is truly manageable through the use of anesthesia, and they can actually come through and see us. Our centers are open across the country.
Well, there you have it. Sizwe Hlongwane from Right to Care, telling us, debunking some of the myths surrounding circumcision, maybe allaying some of your fears if you're considering circumcision as a way to reduce the susceptibility to HIV/AIDS. Sizwe, thank you for joining us. Newsworld is going to take a short break. More news updates when we return.